For Sarah Miller, life was perfect. At just 32 years old, she was an active, health-conscious woman with a promising career and a loving family. But one decision, one routine surgery, would change everything. She walked in a hospital for a simple procedure. She was supposed to walk out the next day, but instead, she never walked again. What went wrong? How did a routine surgery turn into a nightmare? Sarah was undergoing a lumbar laminectomy, a common surgery to relieve pressure on spinal nerves. The risks? Minimal. The doctors had performed this operation hundreds of times, but what the surgical team didn't know was that a tiny, invisible mistake was about to be made. A single millimeter can mean the difference between success and disaster. As the surgeon worked delicately around her spinal cord, something happened in the blink of an eye. Something so subtle, it went unnoticed. Sarah was stitched up. The team was confident. The operation was considered a success. But when she woke up, she was paralyzed. At first, doctors assumed it was just post-surgical swelling. Give it time, they said. But as the hours passed, the truth became undeniable. An unseen injury had been inflicted on her spinal cord. A small dural tear, leading to severe spinal cord damage. And now, she was permanently paralyzed. One small error, a lifetime of consequences. So, how did this happen? How does a common procedure leave someone forever disabled? Even the most skilled surgeons work within a margin of error. The spinal cord is extremely fragile, and a tear in the protective dura mater, the thin membrane surrounding it, can be devastating in some cases. These tears are recognized and repaired. But if missed, the damage can be irreversible. Sarah's life had changed forever. She faced years of therapy, trying to regain even the smallest amount of mobility. But the reality was harsh. She would never walk again. Instead of surrendering to despair, she chose to fight back. She became an advocate for surgical safety, raising awareness about the risks patients never think about. So the question is, could this happen to you? While surgical errors are rare, they are very real. Before any procedure, make sure you understand the risks, ask about your surgeon's experience, know your alternatives. Because sometimes, even a routine surgery can take a turn you never expected. Sarah's story is a warning, a reminder that medicine, though life-saving, is not infallible. Stay informed, stay prepared, because sometimes the difference between life as you know it and a nightmare is just one small mistake. If you want to hear more of our real medical mysteries, don't forget to hit subscribe and turn on notifications. Stay safe.